Okay, it is now time that we want to take some questions directly from the audience. There are going to be 2 microphones. I'm sorry. Where are they? They're coming down. There's one right over here, and one is coming right down in this aisle. I need you to line up at the microphones, and I will go back and forth between the microphones.
Thank you so much. Can you hear me? Senator, thank you so much for coming today. I drove an hour and a half to see you. This issue means a lot to me. And our other Senator Mikulski has broken her ankle, so she has canceled all her meetings. Apparently, she hears her constituency through her feet. So, I'm so happy you're here. I just have to say one thing to you. There are no mobs here. We are all aging hippies and patriots.
We do need you to get to your question, please.
I want you to know that I want this president to stop spending money on this bill. And I want you to know that I believe in this country, and I believe very strongly in this country. And
we're going to have to move to the next person if you don't ask. Over here.
We have one. Hello, we have won the Iraq War. I don't want to spend the next.
Well, look, I'll reconfigure my question and try to get it in. As a citizen of the United States and Marylander, I order you to cease and desist under the 9th and 10th Amendment and Article 1, Section 8 of the United States Constitution to addressing healthcare legislation. If you do not stop, I charge you, Senator Cardin, with usurping authority not granted to you as a United States Senator. What is the enumerated power in Article 1, Section 8 that you're acting under to give you the authority? I don't want to hear general welfare, commerce, or necessary and proper.
Article 1 gives the legislative power to the Congress of the United States. Congress has the power to legislate for the general welfare of the people of this nation. When we went from the Articles of Confederation to the United States of America, we vested in our federal government broad powers to protect the safety and welfare of the people of this nation. That includes receiving reasonable health care being carried out.
Thank you, Senator. You raised in your statement the issue of choices, and I'd like you to address how the public option decreases or increases our choices in health care. I'm happy with my health insurance, but I know people that have none. How does that help?
This is a very important question. It's a very important question. So let me try to answer this. Remember, the public insurance option is one of the issues that is being very much negotiated and debated in Washington. There is no specific proposal on a public option at this point. The reason for a public option, quite frankly, is to make sure that there's an affordable insurance option to those who have no health insurance today that will be required to have health insurance under this bill. That's the purpose, that there be a market. Historically, private insurance companies have avoided certain markets. They've done that. We want to make sure that there are markets available. In 1965, they were not writing a lot of insurance for elderly. We passed Medicare, a public option, and it's worked fairly well over the years to have a public option. The second public option is to keep the costs down. We want to make sure that there's an affordable option for all the people that are now going to be required to get health insurance. Now, whether it's going to be a fallback that only can be accessed for those who don't have private insurance, or whether it's going to be a it's not clear. That's being negotiated. But I can tell you, our objective is to make sure that those that are in private insurance and have private insurance stay in their private insurance plans.
Thank you. Your question?
Yes, the question is, under your and the Congress's involvement in our lives, you've racked up $12 trillion of debt. Yeah. You're adding to it now. Structurally, the USA Today report puts us out, we're $99 trillion in debt. How are you going to look at my children in their eyes and tell them they're going to have a better future with $99 trillion?
I think it's an important question as to the debt. If we don't get health care costs under control, our national debt reform that brings down the growth rate of health care costs will help our children and grandchildren in affording health care and having less debt. I said before, and I'll repeat again, I am not going to vote for any bill that adds to the national debt.
We really do need the audience to respect that there are differences of opinions here, and it is okay. I would like to go to the next question. Please step to the microphone. Thank you.
Thank you. I'm State Delegate Sue Hack from Frederick City. Allowing us to voice our views.
Let's go, lady. Get over there.
My office, like yours, is consistently getting calls about people who are losing their health care. I'm going to say another statistic, since the other side was on the other microphone just said a statistic. We have 700,000 Marylanders uninsured. 700,000 Marylanders uninsured. 7 million in the United States.
Excuse me, please let this.
You touched on this in your opening remarks, but I think it's really important. Would you explain to us who pays for those 47 million uninsured Americans for their health care plans?
I'm going to make a suggestion to try to keep this moving a little faster. Why don't we suggest that everybody take a minute and ask their questions. I won't take more than a minute in answering the questions. Okay, thank you. Everybody take 1 minute, and then hopefully you'll get your question asked. To answer the uninsured, as I said before, the uninsured affect all of us. We have in Maryland over 700,000 without health insurance. These individuals, many of which are workers, have chosen not to have health insurance. They use our health care system. It costs us all money. It's in all of our interests to get everyone into the system. That's what our proposals would do. What we're trying to make sure is everybody has affordable options to be able to have health insurance.
1 minute, sir.